Did you know that a single mosquito bite could lead to a condition so severe it can swell your limbs to the size of an elephant's leg? It's called elephantiasis, and it's more than just a shocking transformation. It's a life-altering disease that affects millions, mostly in tropical regions. Stick with me for the next 20 minutes, and I'll uncover what causes this condition, the warning signs you can't ignore, and practical steps to protect yourself or manage its impact. Trust me, you'll want to know this before it's too late. Let's dive into elephantiasis, a disease often whispered about but rarely understood. Also known as lymphatic filariasis, it's a parasitic infection that causes dramatic swelling in the arms, legs, genitals, or even breasts, making everyday tasks like walking or working feel impossible. Imagine waking up one day to find your leg so swollen it's hard to move. That's the reality for over 120 million people worldwide, especially in places like Africa, Southeast Asia, and parts of South America. To put it in perspective, that's like the entire population of Japan living with this condition. I think of Maria, a 38-year-old farmer from Uganda, who noticed her ankles swelling slightly after years of mosquito bites. She brushed it off as fatigue, but within a few years, her leg was so large she could barely tend her crops. Her story shows how this disease creeps in silently, which is why understanding it is so critical. Let's break it down by exploring what causes this condition and why it's so devastating. First up, let's talk about the root cause. Parasitic worms. Elephantiasis is caused by tiny, thread-like worms, like Wuchereria bancrofti or Brugia malayi, that are carried by mosquitoes. When an infected mosquito bites you, it deposits larvae into your skin. These larvae sneak into your lymphatic system, the network that helps your body drain fluids and fight infections. Over time, the worms grow into adults, sometimes living for years, clogging your lymph vessels like a dam blocking a river. This blockage causes fluid to build up, leading to massive swelling. Picture a garden hose kinked so water can't flow. That's what's happening inside your body. In places like rural India, where mosquitoes thrive, a single bite can start this chain reaction. But here's the thing. It often takes repeated bites over years to cause severe symptoms, which is why long-term residents in tropical areas are most at risk. So, how do you know if this is happening to you? That's our next point. Next, let's look at the early warning signs, because catching this early can make all the difference. The tricky part? Most people don't notice anything at first. The infection can hide for years, quietly damaging the lymphatic system. But when symptoms do appear, they often start with subtle swelling, usually in the legs or arms. You might feel a slight puffiness, like your shoes are suddenly too tight. Other early signs include fever, chills, or a general feeling of being unwell, almost like the flu. For example, think of James, a fisherman in coastal Nigeria who ignored a mild fever and slight leg swelling for months, thinking it was just from long days on his boat. By the time he saw a doctor, his leg had doubled in size. These early symptoms are easy to dismiss, but they're your body's red flags. If you live in or travel to a tropical area, paying attention to these signs is crucial. But what happens if the disease progresses unchecked? Let's explore that next. Now let's talk about the chronic stage, where elephantiasis earns its name. When the lymphatic system is severely damaged, the swelling becomes extreme. Limbs can grow so large they resemble an elephant's leg, with thick, hardened skin that's rough to the touch. This isn't just cosmetic, it's painful and disabling. People with advanced elephantiasis often struggle to walk, work, or even perform basic tasks. In men, it can cause hydrocele, a swelling of the scrotum that adds physical and emotional burdens. Beyond the physical toll, there's a heavy social stigma. Imagine being shunned by your community or losing your job because of how your body looks. In a study from Nigeria, researchers found that people with elephantiasis often face depression and isolation due to this stigma. This stage is a wake-up call about why early detection matters. But what puts you at risk of getting to this point? Let's dive into that. Risk factors are our next focus, and they're more common than you might think. Living in or frequently visiting tropical or subtropical regions like parts of Africa, Asia, or the Pacific Islands is the biggest risk, especially where sanitation is poor and mosquitoes are rampant. It's not just one bite. Repeated exposure over time increases your chances. Children in these areas are especially vulnerable, as infections often start in childhood but don't show symptoms until adulthood. Other factors include a weakened immune system or frequent skin infections, which can worsen lymphatic damage. Think of it like a leaky roof. Small drips don't seem bad at first, but over time, they cause major damage. For instance, in a 2023 study in Angola, researchers found that older adults had higher rates of infection, likely due to years of exposure. Knowing these risks is key to prevention, which leads us to our final core point. Let's talk about diagnosis, because catching elephantiasis early can prevent its worst effects. Doctors typically start with a physical exam and ask about your travel history or if you live in an endemic area. The gold standard for diagnosis is a blood test, often done at night because the worm's larvae, called microfilariae, are most active then. These tests look for the parasite or its antigens in your blood. In some cases, ultrasounds or X-rays are used to spot adult worms or rule out other causes of swelling. For example, in a clinic in Malawi, a simple blood test helped a woman named Aisha confirm her infection before her symptoms worsened, allowing her to start treatment early. The catch? In many rural areas, access to these tests is limited, which is why awareness is so vital. Now that we've covered the causes, symptoms, risks, and diagnosis, let's move to what you can do about it. The good news: elephantiasis is preventable and, in many cases, manageable. First, if you're in a high-risk area, protect yourself from mosquito bites. Use insect repellent, sleep under treated bed nets, and wear long sleeves, especially at dusk when mosquitoes are most active. Think of it like putting up a shield against an invisible enemy. If you're traveling long-term to places like Southeast Asia, talk to your doctor about preventive medications like diethylcarbamazine, DEC, or ivermectin, which can kill the worms before they settle in. For those already infected, medications like DEC, often combined with albendazole, can stop the infection from spreading, though they don't always kill adult worms. In chronic cases, simple habits like daily washing and moisturizing swollen areas can prevent infections that worsen swelling. Elevating affected limbs and gentle exercise also help. Surgery, like for hydrocele, is an option in severe cases. In 2024, the WHO reported that mass drug administration programs have reduced infections by 50% in some countries, showing that these steps work. Small changes can make a big difference, and you don't have to face this alone. Before we wrap up, let's touch on the emotional side. Living with elephantiasis can feel isolating, but support groups, both in person and online, can connect you with others who understand. Ask your doctor about local resources, or check platforms like the WHO's website for guidance. Taking control of your health starts with knowledge and action, and you're already a step ahead by watching this. To sum it up, elephantiasis is a serious but preventable disease that starts with a mosquito bite and can lead to life-changing swelling if ignored. We've covered its parasitic cause, early signs like subtle swelling or fever, the chronic stage's disabling effects, risk factors like living in tropical areas, and how blood tests can catch it early. Most importantly, you can protect yourself with mosquito defenses, medications, and simple care routines. If any of these signs sound familiar, or if you're planning travel to a high-risk area, don't wait. See a doctor for a checkup or blood test. Early action can save you from years of struggle. Drop a comment below if you've heard of elephantiasis before or know someone affected. We'd love to hear your thoughts. And if this video helped you understand this disease better, hit that subscribe button and tap the bell for more health insights that could change your life. Thanks for watching, and I'll see you in the next one.